All right, I would like to welcome everyone to meeting number 2 of the House Standing Committee on Health Services. We're happy to be back and holding meetings. So we have a few things on our agenda today. I do have some members who are going between health services and state government today. So we're going to go ahead and call the meeting to order. And DJ, please take the roll.
Representative Bratcher. Present. Representative Bray. Representative Burke.
Here.
Representative Callaway.
Present.
Representative Camuel.
Here.
Representative Dotson. Here. Representative Fleming.
Present.
Representative Gordon.
Yes.
Representative Holloway.
Yes.
Representative Marzian. Representative Neighbors.
Here.
Representative Proctor. Representative Rayburn.
Here.
Representative Raymer.
Here.
Representative Riley. Here. Representative Sharp.
Present.
Representative Wilner.
Here.
Vice Chair Duval.
Here.
Chair Mosier.
I'm here. Okay, we have a quorum established to do business, and we're going to go ahead and proceed. We have House Bill 219 on the agenda first for consideration. Representative Rebecca Raymer is here. If you can introduce yourself for the record and have your guests do the same and proceed.
Thank you, Chair. Rebecca Raymer, State Representative, District 15.
Good morning. Jenna Cassidy, Kentucky Association of Sexual Assault Programs.
Good afternoon. I'm Wynn Stevens. I'm here representing Children's Advocacy Centers of Kentucky.
Okay, and first, which I have the bill, and then I have a concurrent resolution that kind of go together. So we'll talk on the bill first, and I do have a committee sub we need to adopt.
Motion. Aye.
Oh. No. Representative Wilner.
I just wonder if we could get a really quick overview of.
Sure. So the committee sub just made some minor changes. It added word that said board certified child pediatrician or designee and a children's advocacy center to the required instruction. So it just wanted to catch that population and make sure we were meeting those needs. You're welcome. So House Bill 219 has come about because started last session, I started hearing reports about there being gaps in our coverage with sexual assault nurse examiners in our emergency rooms. And while that is a big problem that we need to address, and I think it's a multifaceted problem, and it requires some research and some data for us to know how to correctly address it, what House Bill 219 will do is it's a fix in the meantime while we are trying to address the larger problem. This bill just states that emergency services will provide mandatory training for their emergency medical staff on sexual assault emergency response requirements. The training will be developed in collaboration with the Sexual Assault Response Team Advisory Committee, and it's going to be a collaborative effort. I've talked to KHA, KMA about it. Neither one of them are in opposition, and I'm happy to answer any questions on the bill.
Okay, we have a motion and a second. Are there any questions from members? Representative Marzian.
I apologize for being a little late. Was this approved by the same nurses too, this bill?
I have not specifically ran that by them.
Okay, thank you.
Mm-hmm.
Okay. It's my understanding that this is merely training, not a certificate. It's not a certification for sane nursing. This would just allow patients to be referred to the resources that they need in an emergency department, and we would protect the evidence and also ensure that patients aren't being sent away to another facility. Is that correct? Just so that our emergency department staff have the information that they need.
That's absolutely correct.
Okay. All right.
Yeah.
Okay. All right. Representative Sharp.
Thank you, Madam Chair. Representative Raymer, I just have a question as far as who does the training for the collection of evidence for these nurses.
Do you want to?
Yeah, sure. Good morning. Like I said, my name is Jenna Cassidy. I'm the staff attorney for Kentucky's Rape Crisis Centers. We work in collaboration with the Sexual Assault Nurse Examiner program coordinators that are stationed throughout the state and offer the training on forensic evidence collection for medical providers who are interested in learning more about that.
Is law enforcement involved in that training to help that coordinator?
So, a sexual assault forensic examination kit is a tool that's issued through the Kentucky State Police Lab. And so the law enforcement instruction piece is contained within the kit.
So you're just going off the written instructions within the kit?
So there's written instructions within the kit that help guide the medical provider as they're doing the exam. And then the instruction for those who are credentialed and SANE, have their SANE credential, they have a much more detailed curriculum and training that they go through in the process of getting that specialized training.
Okay, thank you. Thank you, Madam Chair.
Anyone else? No? Okay. All right. DJ, please take the roll.
Representative Bratcher. Yes. Representative Bray. Representative Burke.
Yes.
Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson. Yes. Representative Duval.
Yes.
Representative Fleming.
Aye.
Representative Frazier Gordon.
Yes.
Representative Holloway.
Yes.
Representative Marzian. Yes. Representative Neighbors.
Yes.
Representative Proctor.
Yes, and I'd like to record my attendance, please.
Representative Rayburn.
Yes.
Representative Raymer.
Yes.
Representative Riley. Yes. Representative Sharp.
Aye.
Representative Wilner.
Yes.
Chair Mosier.
Yes. Okay. House Bill 219 passes with favorable expression. The same should pass on the House floor. Thank you for bringing this important measure before us. And if you want to go ahead and talk about resolution, House Concurrent Resolution 20.
Yes, thank you. So, like I said, House Bill 219 was something that I saw as a fix to a larger problem until we can solve this. So what we really want is we want those sexual assault nurse examiners that have that training in these hospitals. We want them to be there when our citizens at possibly one of the most vulnerable times in their life walk into an ER. They need to have the correct treatment by the correct individual. So what House Concurrent Resolution 20 does is it directs LRC to conduct a study looking at where we have gaps in coverage, why do we have gaps, try to find out what hospitals are doing when there's not a sexual assault nurse examiner on staff. And this is just to gather the data so that we can come back, and I've asked for it to be given to me this December so that hopefully next session we can come back and we can address the larger problem. And I'm happy to answer any questions.
Okay. Thank you. Are there any questions from the committee? Okay. I think it's pretty straightforward. And when we're talking about the training, I just went back to the bill, and the training curriculum is developed in collaboration with members of the Sexual Assault Response Team Advisory Committee, and they've been asking for more SANE nurses for years. So I think that this will support that. Of course, now we will be able to actually see the data. So I think that's really important. Okay, is there a motion on the resolution? Okay, I have a motion and a second. No questions. DJ, please take the roll.
Representative Bratcher. Yes. Representative Bray. Representative Burke.
Yes.
Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson. Representative Duval.
Yes.
Representative Fleming. Aye. Representative Frazier Gordon. Representative Holloway.
Yes.
Representative Marzian, Representative Neighbors,
Yes.
Representative Proctor, Representative Rayburn,
Yes.
Representative Raymer,
Yes.
Representative Riley, Representative Sharp,
Aye.
Representative Wilner,
Yes.
Chair Heverin.
Mosier.
Sorry.
It's all good. All right. It's a busy day, right? House Concurrent Resolution 20 passes with 16 favorable votes, and the same should pass on the House. We do have some members who will need to record votes when they come back from state government. So thanks, DJ.
Thank you, Madam Chair, for hearing this
Of
piece of
course.
legislation.
Yeah, thank you for bringing it. It's important. Thank you. All right, next on the agenda, we will hear about House Bill 303. Representative Steve Bratcher is with us, and welcome, Representative Bratcher. Just introduce yourself for the record and proceed with your testimony.
Representative Steve Bratcher, 25th District.
Welcome.
So thank you for hearing this, Chairwoman Mosier, and thank you to the committee for hearing it. This bill, House Bill 303, is a bill that allows military people in the military medical profession to leave the military medical profession and be bridged over to in the civilian job in Kentucky to get a certification or a certificate to be able to accomplish that same task or job role in the state of Kentucky. So it allows the schools, the colleges, to identify the military training that a person has had, whether it be from the any of the branches of the service. They'll convert that into credits and then identify the gap that they need in order to complete the requirements to be able to sit for a board exam or a licensure. That's pretty much the bill. As you can see down there, there's several different areas, not limited to those 27 different areas, including aerospace technicians, pharmacy specialists, radiography, nutrition, optometrist. So it basically takes most or all of the medical professions in the military and helps convert them to the certification for the state. And if they're lacking anything, of course, the colleges can identify, instead of going through the entire program, they go through 2 courses and they'll be able to sit for their license.
Okay. I understand that we have a last-minute committee sub that addresses the difficulties that KCTCS had with the cost that they thought they might incur. And so do you want to explain what the committee sub does, and then we can adopt the committee sub?
Yes, ma'am. The committee sub it was a KCTCS. You would go through KCTCS to get your certification and bridge the gap. Now it's any institution, college, state institution in Kentucky. So you can go to UK, U of L, any of the state institutions. That's accredited programs.
Right. Okay. Thank you. We have a motion on the sub. Do we have a second? We have a second. All in favor of adopting the committee sub? Aye. Aye. Any opposed? Okay. All right. Are there any questions on House Bill 303 as amended by the House Committee sub? Representative Marzian.
Thank you. Just a quick question. Were all the universities okay with the expansion of their?
Thanks for the question. This is a volunteer program. They're not mandated to do it, but if they want to participate in it and offer the veterans more opportunity to advance their degrees and get certified, then they can do it. But it's an optional program.
Okay, Representative Dotson, do you have a question?
Yes, thank you, Madam Chair. Just real quickly, being in prior military and having been trained in radiology and coming over to the healthcare in the civilian world, how would that look? Just explain to the committee, how would that look? Would we have to go? Because I know we had to take the ARRT test after coming out. Would that suffice, or would there be extra training on top of that? Just kind of wanted to see what you had to say.
It would be based on the commission or board that oversees that credential or criteria. For example, the Board of Nursing, if a person came out for Air Force medics, for example, an Air Force medic right now can come out and take the exam for an LPN license. And then once they take the exam and they want to go from an LPN license to a RN, then the college or university can bridge that person over. But what they'll be doing is looking at your credentials and looking at your background to see what experience you had, and counting some of that as credit so that to bridge you over. And then you're still required to take the exam. So this doesn't keep you from having to meet the same requirements of the exam for licensure. So everybody should be on the same knowledge base whenever it comes to the end. You're just recognizing the experience and background. And for example, the Air Force medics can become LPNs. They have a lot more clinical background than some of the field medics as corpsmen or Army medics, and so they would not be able to do that. They would need some more clinical hours in order to bridge over.
Thank you for that explanation.
Okay. All right. Are there any? Oh, Representative Fleming.
Thank you, Madam Chairman. I wasn't going to say Hebron. I don't know if that's an upgrade or downgrade. But anyway, that's another comment. Representative, just curious. It's more of a general question in terms of promoting and marketing this to the military when they do come out and they want to continue. Is there anything in process or you know of to make sure that these individuals are aware of these programs?
That's a good question. In the bill, you'll see where it references a skill bridge program. So each military organization has a skill bridge program where it basically allows you to go and work or to identify areas that would be most applicable to what you have accomplished in the military. So it directs the organizations to be able to use that skill bridge program and identify that in order to bridge them over is what you're doing. So it should work in conjunction with what Kentucky Department of Veterans Affairs has, the Department of Labor, and other organizations that support military programs like this.
Thank you.
Okay. Thank you. All right. See no further questions. DJ, will you please take the roll? Oh, we need a motion. Anyone? I'll entertain a motion in a second. We have a motion in a second. All right. Now, DJ, please take the roll.
Representative Bratcher,
Yes.
Representative Bray, Representative Burke,
Yes.
Representative Callaway,
Yes.
Representative Camuel,
Yes.
Representative Dotson,
Yes.
Representative Duval, Representative Fleming, Representative Frazier Gordon,
Yes, and I would also like to record a yes vote on House Concurrent Resolution 20, please.
Representative Holloway,
Yes.
Representative Marzian, Representative Neighbors,
Yes.
Representative Proctor,
Yes.
Representative Rayburn,
Yes.
Representative Raymer, Representative Riley, Representative Sharp,
Aye.
Representative Wilner,
Yes.
Chair Mosier.
Yes. Okay, thank you. House Bill 303, as amended by the committee sub, passes with unanimous support and should pass on the House floor. Thank you very much for working on this important legislation. I'm a big supporter, and I think this is going to make a difference. So, thanks.
Thank
All
you,
right.
Chairwoman Mosier, and thank you, committee.
We do have a few members who are still in state governments who may need to come and record a vote, but in the meantime, we have some administrative regs that are coming before us. Have all members had an opportunity to review those regs? And are there any questions? Representative Fleming.
Thank you, Chairman Mosier. Is there anybody here from administration that may ask a question? Because you may know, Madam Chair, I didn't ask you earlier, but I know on the behavioral regulation 15005, it was found deficient in October, and I assume that's gone through the process for the admin regulations. I guess found it to be sufficient and satisfy things. Is that correct? KAR 015005, is that the one? Yes, ma'am.
Yeah. So that came through the administrative regs, and yes, it was found deficient. We had it here and deferred it to try to get some resolution. It's my understanding that it came back before the Senate Health Services and was again found deficient. And so I I think that this will be handled in a Senate Bill 65 situation where some of the needed changes will be codified.
Okay.
Statute.
All right. Thank you, Madam Chair.
Okay. All right. Well, seeing no further questions, we'll consider those administrative regs reviewed. I'm so sorry. Did you want to comment?
No, we're good.
We were just available for quiet. We were just available for questions.
Oh, thank you so much. All right. Is your question answered? Yeah. Okay. Thank you. Sorry, Jonathan. All right. Well, I think we need to keep the committee open for a minute to allow other members to record a vote. For all intents and purposes, we are finished with the business of this committee, but we just need to stick around a few minutes and allow our members to vote. So thank you for joining us. If you're welcome to stay if you would like, but you don't have to. Thanks. All right. Representative Duval, would you like to record a vote?
I would like to record a vote. Yes, that.
On?
303.
Yes. Okay. Thank you. Okay. Having no further business to come before this committee, the next meeting of Health Services will be held on February 20th at noon in the same room, 149.